Hello everybody, my name is John Snedeker. I'm the founder of Lasara.com, and in this video I'm going to show you how to prep and inject a subcutaneous testosterone injection. To prep your injection, first you want to make sure that you have sterilized your working environment and you have cleaned your hands with soap and water and scrubbed them for at least 20 seconds. To prep your injection, first you'll take an alcohol prep pad and clean the top of your vial and set that aside to let the top of it dry. Next, you'll remove your syringe from the packaging and remove the needle you'll be used for drawing up the medication. In this example, I have a 20 gauge 1-inch needle. It's also common to use an 18 gauge, even up to a 25 gauge needle for drawing up the medication. From here, you'll open up the packaging and twist the needle onto the syringe. Next, you'll remove the cap and draw the plunger back to the desired dose. In this example, we'll be pulling back to the 0.5 milliliter, as we'll only be injecting 50 units. After drawing the air back into the plunger, push the needle through the top of the vial and press the air into the vial. By pressing air into the vial, you're creating pressure in the vial to make it easier to draw the medication back. Here you can rotate it upside down and draw the desired dose. Once you get to your prescribed dose, rotate it back to right side up and pull the needle out. Next, you'll recap your drawing needle. Simply place the protective cap onto the table and scoop the needle up so you don't poke yourself with the needle. For subcutaneous injections of testosterone, we typically recommend a 27 gauge 1/2-inch needle. And now you can switch out the needle for the injection. Just simply twist the needle off and replace it with the injection needle. Prior to injecting, use an alcohol prep pad to clean off the injection site. You'll then let that dry. And now you're ready to inject. Remove the cap. Make sure you do not have any air bubbles in the syringe. Pinch a part of the fatty tissue and push the needle straight in. Press the plunger down and remove the needle. And that is how you do a subcutaneous testosterone injection. Should you have any questions about your protocol or need instructions on how to inject, feel free to reach out to our medical team at Lasara.com.